Last Friday was World Hearing Day, and we welcome audiologist Leiyla BahBahni to the program. Leiyla, the focus of the day was to promote ear and hearing care for all. We know to visit an optometrist, get our sight checked, but I think a lot of people avoid getting their hearing checked. Why would that be the case, and do you recommend it become part of our regular health routine?
Yes, absolutely. Oftentimes with hearing, it's so gradual that one does not often think about having the hearing tested until it's at a point if one experiences a sudden hearing loss or has some ear drainage or pain in their ear or fullness, then they usually go to their MD or their nurse practitioner and seek some advice for their hearing. So I think this year, with the World Health Organization coming up with the theme of ear and hearing care for all, let's make it a reality. The focus, from what I understand, is that they wanted to integrate hearing care at the primary level, where a patient can go to their MD, go to their care, to their nurse, even go to any allied health professional, such as a physiotherapist, a chiropractor, and just see if they can help them assess and manage their hearing. And what people often don't think about is they can also go to a hearing center. And we, as audiologists, we can assess, diagnose, manage, and help to treat hearing loss. And if medical intervention is needed, we can refer them to see and at their family doctor to see an ear, nose, and throat specialist.
Leiyla, you operate Premium Hearing Clinic in Beamsville. What is actually involved in a hearing test at your clinic?
For sure, first have a look, an otoscopic examination. So with an otoscope and our instrument, look in the ear to assess, is there any earwax that's causing some hearing loss? And if there is, I have the means to remove and address the earwax at our clinic. And then we also check for the middle ear function and the tympanometric assessment. And then we take the patient into the sound booth and do some pure tone testing across all frequencies in each ear, and figuring out, is there a difference between ears, or are both ears symmetrical, and then doing some speech testing as well. And at the end of the test, it usually takes about 20 to 30 minutes, and then we provide the results and give our recommendations on what the treatment should be going forward.
After that diagnosis, what are some of the potential treatments that could be prescribed?
So sometimes it may be a referral back to the family physician to refer that patient to an ear, nose, and throat specialist. If there's a difference between ears and asymmetrical hearing loss, or if they have other symptoms such as vertigo or dizziness, or if they have a perforation in their eardrum, um, most times it's something that we can do in-house as well. So habilitation wise, or rehabilitation would be through a personal amplification device such as hearing aids, um, where a client can get fitted with an appropriate hearing aid based on their hearing loss, and fit according to what they need to hear better, to engage in their social life, to improve their quality of life, so that they don't restrict themselves because of their hearing loss.
Leiyla, I can't let this interview end without asking you the Q-tip question. I've seen it all over the place. Q-tips are supposed to stay out of the ear, aren't they?
Absolutely. I would always tell my clients, if you have to feel like you need to clean your ears, use a Kleenex or a wet cloth just on the outer side, because while you may go in with a Q-tip, and sure, we've all used it, it feels good, especially if there's an itch. We get some of the wax out, but also some of it gets pushed further in. And there are numerous cases, pardon me, where I've had patients who they've perforated their eardrum by trying to remove the wax, because either one, I remember one very story of a mom who she had her hand like going in her ear, and her daughter opened the door and pushed in. Yes, that was an accident, but it doesn't always have to be an impact. It can just be going in and trying to remove the wax. And Absolutely, you can perforate, and now we're causing more issues because we have to go see an ear, nose, and throat specialist who takes now 6 to 12 months or longer to see that specialist. And then there's hearing loss because we have a hole now in the eardrum.
Thank goodness, Leiyla. I always wanted to hear it straight from an audiologist's mouth. Keep the Q-tips out of there. Thank you so much for your time.